Welcome to the brand new episode of Youth Diary. A gynec is somebody who provides solutions to the entire womanhood. Today we have with us Noshin Ashraf, infertility specialist and director, Kraft Hospital. Welcome ma'am to this new episode. So you're an infertility specialist.
Yes.
So when do you actually consult a couple to come for the infertility evaluation?
Okay. Generally, when a couple fails to conceive or become pregnant after 1 year of unprotected sexual intercourse, then they require an evaluation.
Okay, thank you doctor. Now let's move on to the queries. So this is the first query.
Hi, I am Krishna. I have a doubt. One of my close friend has severe abdominal pain during periods, and she consulted a doctor and had a scan. Then they found a cyst in one of the ovary. So my question is that what is a cyst and what should we do now?
It's quite sad to hear that nowadays even young girls are having endometriosis. From the history she revealed, mostly her friend is having a chocolate cyst which is due to endometriosis. Endometriosis is a condition where uterine lining cells are present outside the uterus. So what happens is like when a girl is having menstruation, just like how the uterine cells bleeds, these cells which are present outside the uterus also bleeds. This leads to severe pain and then eventually leading to scarring, adhesion and cyst formation. The sad part of the disease is that it's a progressive disease and the disease gets suppressed only during pregnancy and after menopause.
So what can be done in this situation?
A scan has to be done to know the exact size of the cyst and to rule out the malignant nature of the cyst, though it is very rare. And then depending on the size of the cyst, the management protocol varies. Suppose if the cyst is very small and if she is unmarried, then she can be given a few courses of OCP which will suppress the size of the cyst and will take care of dysmenorrhea, that is severe menstrual pain that she is having. Suppose if the size of the cyst is huge or there is a doubtful malignant nature, then the cyst should be removed. But what I need to stress is that maximum amount of ovarian tissue should be preserved during surgery. Studies have shown that most of these girls and then women with endometriosis are found to be subfertile in later part of their reproductive life. So they should even plan for a pregnancy at least before the age of 30 years.
Okay. So doctor, you mentioned the term OCP. Yeah. So what is an OCP?
It is oral contraceptive pills.
Okay, pills. Okay. Thank you doctor. Now let's move on to the next query. This is the query.
Hi, I am Bhima. I have a doubt that my aunt had a history of pregnancy loss during 4th and 5th month of pregnancy, and now she is 2 months pregnant. And what are the precautions that she should take during pregnancy?
First of all, we should try to find out the cause for her multiple abortions. Abortions happening in the 1st and 2nd month of pregnancy and those happening after 3rd month of pregnancy are very different. The common reasons for the abortions happening after 3rd month of pregnancy is mainly due to uterine anomalies, that is abnormalities in the uterus like septate uterus, uniconvate uterus, biconvate uterus and all. Another common reason is cervical incompetence. Then the other cases like immunological disorders or infections can all lead to abortions. She should be detailedly evaluated before attempting for a next pregnancy to prevent the same mishap. What is to be what we can do is that we can do a detailed first trimester screening test. Okay. It is a non-invasive test and involves 2 steps: a combined blood test, maternal blood test and an ultrasound evaluation to rule out major anomalies and a nuchal translucency test. This non-invasive test is called as first trimester screening test. This has got a positive predictive value of almost about 85%. That is 85 out of 100 babies affected with the chromosomal anomalies can be detected by this test. And again, if we are doubtful, if at all the finding has to, if at all the results turns out to be doubtful or we are still doubting it, then this can be confirmed by a NIFTY, which is a non-invasive fetal trisomy test. The advantage of the NIFTY is that this has got a accuracy similar to that of amniocentesis and chorionic villus ambulis, and the advantage is that it is non-invasive. From the history she revealed, her aunt is most likely to have a cervical incompetence. Cervical incompetence is a condition where the sphincter around the cervix weakens and then it fails to hold the pregnancy, leading to early preterm labor. So the cervical incompetence can be easily diagnosed by doing a serial ultrasound monitoring of cervical length, and if any time we find the cervix to be short with this relevant history, we can do a high cervical insert clutch, and then that will save the pregnancy. Along with this, I would like to ask her to do an immunological testing, that is ANA, that is anti-nuclear antibody testing, and APLA test, anti-phospholipid antibody test. And if this test is found to be positive, she should be on heparin therapy and aspirin throughout the pregnancy to prevent the abortion.
So what is the test all about?
This is an immunological test to detect for the autoantibodies in the body. Okay, because if there is these antibodies present in the body, it can lead to abortion unless treated.
Okay, so treatment is necessary.
It is necessary if this test is positive. But what happens, like many places, they empirically give the patient this medicine. Okay, so that is not suggested. But one more thing I would like to insist is that absolute bed rest is not required for all these patients.
Okay, so doctor, we'll move on to the next inquiry. This is the inquiry.
I'm Amrita. My doubt is my cousin sister is married for 10 years and she has no children. During evaluation they found out that her husband has no sperms and they advised for donor treatment. Is there any chance for them to have their own children?
Of course, yes, there is a huge chance. The new advancement in the field of male infertility is a huge blessing for these men. Okay. The absent sperms or no sperms is a condition called as azoospermia. It is of two types, obstructive and non-obstructive. To find out whether it is obstructive or non-obstructive in nature can be identified by a detailed clinical evaluation and can be confirmed by a testicular biopsy. If it is obstructive in nature, treatment is much easier. Either a PISA or a TISA will do. PISA is percutaneous epididymal sperm aspiration and TISA is testicular sperm aspiration. Both of them will give good results for an obstructive nature disease, obstructive nature azoospermia. If it is non-obstructive azoospermia, then a detailed fertility hormone evaluation and a karyotyping to rule out chromosomal abnormality and bichromosome microdeletion has to be done, and then depending upon the scenario, either a TISA or a micro TISA will be offering good results. Micro TISA has got a success rate of 60 to 65%. In India, Kraft is one of the first centers to start this micro TISA treatment, and by this time almost 1,500 babies are born by this micro TISA ICSI treatment method.
So there is a treatment for azoospermia?
Of course, yes. With a good teamwork of andrologist, infertility specialist and an embryologist, there is chance for recovering sperm from azoospermic males.
Okay, thank you doctor. Now let's move on to the male segment. The male goes like this. Recently I have noticed that I am putting on weight despite dieting. I tried several methods to lose weight. Please suggest some fruitful methods to weight loss.
First of all, I just want to tell you not to lose hope and willpower. The common reasons for weight gain among all age group is lack of exercise, wrong eating habits, stress, sleep deprivation, and the hormonal variation. Eating more of refined foods and junk foods, though they are very handy, easily available and very tasty, they provide only frank calories and they don't supplement anything to the body. Most of these foods are addictive in nature, and that is that make us crave for them more.
Okay. So you really think junk foods are the sole reason for weight gain?
Yeah, it is one of the main factors. So I would suggest them to cut down more of junk food, eat more of salads and vegetables. Then another tip is don't skip breakfast. Make breakfast the heaviest meal of the day and the dinner the lightest. Many people have the habit of skipping breakfast, either due to stressful work activities or as a part of dieting. But as such, by skipping breakfast, it lowers the metabolism and over a period of time lowers the basal metabolic rate, and then this will lead to weight gain. Okay. So don't skip breakfast. Another tip is to take frequent small quantities of food every 3 hours, but again be watchful on the quantity. Take more of proteins like meat, fish, pulses and all, and more of fruits and vegetables. The key is to identify what you really want and to indulge in those once in a while and not as a routine.
Okay. So can you talk something about the exercise that they have to undergo?
Yeah, exercise also plays a major role in weight loss. The exercise is mainly in the form of cardio workout, that is like running, cycling, etc. will be more beneficial. Then another main factor for weight loss is weight gain is stress. If you closely observe, there are many emotional eaters around us. Stress actually increases appetite and will eventually lead to obesity. So try to tackle our minds by meditation, by calling your dear friend, or engage in other recreational activities. Sleep deprivation also plays a major role. At least about 7 to 8 hours of sleep is needed for us. So, and studies have shown that if the sleep is deprived, the leptin levels will go down and ghrelin levels will go up, which has a major role in weight gain. So adequate sleep, tackle the stress, and by exercise, and by doing adequate exercise and proper diet and all, will definitely help in weight loss. Then if he or she tries all these methods and still not losing weight, then she should get evaluated for her hormones, because hormonal variation also can lead to weight gain. Hormonal variation in the form of thyroid abnormalities like hypothyroidism leads to weight gain, constipation, tiredness and all. And another hormone like male hormone, that is called testosterone, its level elevation will also lead to weight gain.
So basically, after following the regular routine, diet and exercise, still she's not losing weight, it has to undergo treatment.
Yeah, with this treatment I'm very sure she or he will definitely lose weight.
Okay, thank you doctor. So the next mail is, my sister's first son is having a genetic disease called muscular dystrophy. They are planning for a second baby, but they are very scared whether some disease will recur in the next pregnancy. What is your opinion?
Yeah, there is a chance for recurrence of almost about 25%. Muscular dystrophy is an X-linked genetic disorder where females are carriers and males are affected. It occurs 90% due to genetic cause and 10% due to sporadic cause. So what can be done in this situation is to do a DNA analysis for the mother to detect her carrier status, and if she is found to be carrier, the best treatment which can be offered to her is ICSI-PGD.
So can you tell us what an ICSI-PGD is?
ICSI-PGD is a procedure where we artificially stimulate the ovaries to produce multiple oocytes by giving multiple injections and thereby producing multiple embryos. So what advantage is that we can do embryo biopsy on these embryos to detect whether the embryo is having the genetic disorder, and we can transfer those embryos which are not affected, leading to a successful live birth. In India, Kraft is the first center to start with this ICSI-PGD.
Okay. So doctor, if a woman can't conceive for a really long while, once they got to the hospital, what are the different stages or procedures that they have to undergo?
More of a couple evaluation, because what happens is many times the female will come to the hospital and she will be treated, and then later we will diagnose that the male is having a problem. So there will be a lot of delay unnecessarily. So it should be always a couple evaluation. When they first come to hospital, it should be, the first step is to do a semen analysis and a semen culture for the male, and for the female a basic evaluation like hormone evaluation like involving thyroid, prolactin and all, and ultrasound to rule out many major causes, major anomalies, and ultrasound evaluation and a tubal patency test will do. Then depending upon the scenario, the treatment varies. In most of the situations, IVF, ICSI or PGD and all is not required. A simple cost-effective treatment will provide a successful pregnancy for majority of the patients.
Okay, thank you doctor. My friend became pregnant after 2 years with the help of IUI treatment. So doctor, can you tell us what an IUI treatment is? Okay,
IUI is intrauterine insemination. It can be offered for couples, those who are having borderline male factor like semen count is little less, and those who are having unexplained infertility or with mild endometriosis. In this case, we give oral medications for the follicular development in the ovary, and once the follicles develop and goes to a adequate size, we give an injection for the ovulation to occur, and once ovulation is documented, then we artificially inseminate semen into the uterus. This has got a success rate about 10 to 20%. This can be one of the basic treatment modality.
Thank you doctor. That was another informative segment. Please mail your queries to youthdiary@rosebowl@gmail.com. Stay tuned for the next episode. Thank you.